Okay, so I did my project on fetal alcohol syndrome, and I'm sure you guys can kind of guess what this is about. So fetal alcohol syndrome is a syndrome obtained by a fetus who's exposed to alcohol from maternal consumption through pregnancy. That alcohol and its toxins cross the placenta and reach the fetus. And it was thought that more than 1 drink per day or half an ounce would bring negative effects upon the fetus. However, a recent study states that only half a drink per day may cause a fetus to have a poor outcome, but there really is no safe amount of alcohol that you can drink without, knowing that you're not going to harm your baby. Any alcohol during pregnancy has a risk of harming your baby. Fetal alcohol syndrome includes central nervous system abnormalities, facial abnormalities, and growth abnormalities. And in a study, this was in one of my articles, in a study of pregnant Danish women, 74% of them thought that it was okay to drink while pregnant. So that was really interesting to me because in their culture, they do drink a lot, and a lot of binge drinking happens. So, I guess they really didn't care, or they just thought that alcohol doesn't harm the body or the fetus as much as it really does. So the diagnosis is based off of 3 criteria, which are the fetus's height and weight being below the 10th percentile, specific facial features such as a smooth philtrum, which is like above the lip, and a thin upper lip, and small palpable fissures and underdeveloped midface features. So, and the other one is central nervous system abnormalities such as decreased head circumference, sleep disturbances, attention deficits, decreased response to noise, hyperactivity, and problems with developing speech, learning, and visual focus. So in this image, I liked it because it showed an actual person and a little diagram. So, this person has small eyes, and they have this little, a flat nasal bridge, and it kind of creates a little nook right here, and then which are called epicanthal folds, and then an upturned nose, smooth philtrum. So instead of having if you run your fingers across right here, you feel those 2 little ridges, and a thin upper lip. And here's a baby that has fetal alcohol syndrome. So fetal alcohol syndrome is actually determined after birth on ultrasound. These babies appear normal, but some associated anomalies could be seen on ultrasound, usually in the 2nd trimester, including a small head, neural tube defects, a small chin, cleft lip and palate, diaphragmatic hernia, vertebral malformations, small genitalia, and a normal looking placenta with low amniotic fluid. But as you all know, these things on ultrasound, could be related to a bunch of other things. So in your head, you probably wouldn't be thinking, oh, this is fetal alcohol syndrome. So, and here's that little baby, and he has the smooth philtrum, thin upper lip, upturned nose, the folds, and small eyes. So risk factors and outcomes, school failure, difficulty with peers, behavioral issues, mental health disorders, crooked teeth, inner ear tube infections, and problems in language, motor, learning, and visual spatial functioning. And risk factors are chronic drinking and drinking while pregnant, obviously. And so it was weird because when I was searching images for this Nicholas Cruz kept popping up, and this is, I'm sure you guys know who this is, but he's the guy who killed 17 people at Parkland High School. And I really kind of tried to ignore these images because just looking at him like gives me like chills, bad ones, but eventually I was like, okay, why does images of him keep popping up? And I read an article, and they actually think that he could possibly have fetal alcohol syndrome, or because he has the facial effects of it. I mean, the folds, small eyes, his nasal bridge is flattened, the smooth filled trim, and a thin upper lip. And nothing was like confirmed or anything. And he also got expelled from school for behavioral issues in the past, and things like that. So they were wondering if that could be related, but like I said, nothing was confirmed. And they said if not that, obviously he has some underlying, like they said, like brain issue. So I just thought that was interesting. And there's his nose, eyes, and lip. For the treatment, there really is no treatment because it is diagnosed after birth. The treatment would be considered preventative strategies, such as do not drink while pregnant and screening women of childbearing age for alcohol use. Although there's no treatment for fetal alcohol syndrome, some things can be done to manage some of the existing symptoms. For example, like speech therapy can be used on a child who's experiencing the symptom of language issues and things like that. So I really cannot talk today. Some statistics, I read that in 2003, the National Survey of Drug Use and Health, women 15 to 44 years of age, 9.8% use alcohol and 4.1% binge drank in the month before they took this TA survey. And the TA survey is a survey that takes less than a minute to complete, and it is used to screen for pregnancy risk drinking. And so the T stands for tolerance, and the question that's asked is, how many drinks does it take you to feel high? The A stands for annoyed, and that question is, have people annoyed you by criticizing your drinking? C is cut down. Have you felt like you ought to cut down on your drinking? And E is eye opener. Have you ever had a drink the first thing in the morning to steady your nerves or get rid of a hangover? So the scoring, the first question is scored positive if the respondent answers he, well, I don't know really why it says he, or she has more than 2 drinks. A positive response earns 2 points for that question. The last 3 questions are scored as 1 point if answered affirmatively, and a total score of 2 or more is considered a positive score for risk drinking. And the reported incidence of fetal alcohol syndrome ranges from 1 in 50 to 1 in 2,500 live births. The incidence among women who are chronic heavy drinkers is greater, as high as 20 to 40% greater. Up to 90% of children with fetal alcohol syndrome have an ophthalmologic abnormality. However, the number and type depends on the national origin. For example, a study showed that more African American children in the U.S. had a more anterior segment anomalies, whereas children from Ireland and Sweden had more posterior segment anomalies, such as optic disc hyperplasia and retinal vessel tortuosity. Although there has been research done, it is not confirmed that fetal alcohol syndrome has a direct correlation with ADHD, because a lot of kids who had fetal alcohol syndrome, they show the symptoms of ADHD or have ADHD, and they thought it could be related, but they couldn't prove that in a study. In just some cases, you can see that all of these people kind of look a little similar because of their facial features. Each one of them has small eyes and little folds right here. The smooth nasal bridge, the smooth philtrum, thin upper lip, and these are the same people, him as a baby and him as an adult. So I just thought that was a good picture to show what these people look like once they grow up, and those features really never go away. So